Hi everyone, thank you for watching. By law, I have to tell you that this is for entertainment purposes only. All videos are property of Psychic Liz Cross, LLC. Thank you. Hi everyone, welcome back to the channel. We have Dr. Ann Creekmore with us again today. For those of you who have not heard Dr. Ann's shows, Dr. Ann is a highly accomplished licensed clinical psychologist based in Richmond, Virginia. Her exceptional achievements have garnered recognition and honors, including membership in the Phi Beta Phi Honor Society, multiple features in the Who's Who of American Women. She was honored as top doctor, licensed clinical psychologist in Virginia in 2017, and also received the prestigious titles of Virginia Psychologist of the Year in 2019 and 2021, as well as Virginia Clinical Psychologist of the Year in 2021. Now, she has written so many books. Oh my goodness. We're going to talk about some of these books, such as Love Yourself, Love Your Life, Wisdoms and Ways of Abundance, Find Mr. Right or Mrs. Right, The Perfect 10, and Not Fit for Human Consumption, Triggered Traumatic Memories, and the Violence Profile. And that is what we're going to talk about today with Dr. Ann. We're going to touch on violence, flash anger, immediate rage. And I've always been curious about these topics. Dr. Ann, thank you. Welcome, welcome. How are you today?
Great. Thank you. How are you?
Oh, I am better now I spoke to you. I was having a little bit of a meltdown earlier. But I
Oh,
feel so much better now. You really calmed me down. This Mercury retrograde has been working a number on me.
it
And
has.
I was like at my wit's end, and I know you pulled some tarot cards for me, and you got that I was like really stressed, and you were right. You were right. And after I started, you said, "Well, let's talk." And I said, "Okay." So we talked, and I do feel so much better. Thank you so much.
Oh,
So
I'm
look,
so
yeah,
glad.
go ahead. No, you go ahead.
hmm Yeah, no, I was just going to say I'm so glad because that Mercury retrograde is going to be over in a week. It's over now, but it'll be over the shadow. So things should be looking good for you, Liz.
I hope so. And everybody else out there. I don't know anybody, Dr. Ann, this year that has had a really good year. Um,
Mm.
it's been a very challenging year for a lot of people. And what I find, and I don't know if you have anything to add to this, but okay, I can take one thing breaking down. I mean, Mercury retrograde is where everything breaks down, but then another thing, and another thing, and another, and then it becomes very traumatizing to me.
It is. It's like post traumatic stress. It's like, the research they did on like post traumatic stress. I think it was Brady, but about the monkeys where they would give them shots or electric shocks rather, and
Oh,
then they would give it to them at a set time. And then the other group would get it just randomly. And you'd think that, knowing you're going to get this shock might cause you to have some post traumatic stress, but the ones that got it that way, but, were handling it. It's like, well, they knew they're getting it. They handled it. They, moved on. And ones that would just get the same number of shocks and intensity of shots, but randomly, they became completely, post traumatic stress and ulcers and panic and everything else. So it's kind of like when you don't know where it's coming and when it's coming, it's worse than if you just kind of know, well, all right, I got to go into the dentist at this time and I'm doing that. You're
wow.
good with it. But I know you've been through a lot. I
Yeah,
know.
yeah, it's not been my year, but you know what? I am determined to keep marching forward. So, but
Absolutely.
yeah, I do feel a little traumatized by all of it. I'm like, oh my God, what's going to break down next?
Right.
It's one thing after the other. And the last couple of weeks with the Mercury retrograde, I was having two or three things break down in one day
That's
repeatedly.
unbelievable.
And I was getting really traumatized. I finally said to my husband, I'm not dealing with this anymore. I can't handle it anymore. You're going to have to deal with it, which he did. But then even he got to the point where it was traumatic for him as well. So look,
Oh,
We didn't
I'm
resort
sorry.
to violence, you know, thank
Yes.
God we don't have that type of personality. But tell me, Dr. N, as we're going to focus on violence today, how do you actually diagnose that someone has like flash anger, rage anger? Like, how does that come out in an evaluation?
Well, that's a good question. I, I'm interested in the true crime documentary and helping, society to get a handle on reducing, to violence, school shootings or domestic violence or killings or whatever and it may be. And I tend to look at it kind of retrospectively and think that one thing that we haven't realized is that when we do evaluations, clinical evaluations, which is what we're supposed to do as psychologists and mental health professionals, social workers, and professional counselors, and so on, we're supposed to do what's called an in-depth intake package and psychosocial assessment, which includes like a complete history of, their family background, themselves, their legal history, their, substance abuse history, their family's history, and such and so on. And questionnaires to evaluate more than just depression and anxiety, because the majority of people that come in to your, to the office have anxiety or depression or both. But that isn't really, they know that they can describe the symptoms themselves, but we need to get deeper and we need to actually assess them for deeper root functioning underlying disorders,
Mm,
such as
mm.
DID, which, the American Psychological Association says 4.3% of the American population has the blackout between alter types of the DID, let alone the extra 20-25% that have the moderate to mild. They have some co-conscious between their parts, but they still switch and they're still not in control. They're being passively influenced when they go to another part of their brain that holds a different perspective. And the reason I'm bringing this up is that I don't think we really, evaluate, a lot of people don't really evaluate people to find out the main thing that we do know about aggression and who may be aggressive is that they will have been someone who has experienced aggression growing
Mm.
up. They will have either, been witnessing or experiencing physical abuse or aggression. Maybe they saw their parents in domestic violence, but they have had
Oh,
that imprint on them of aggressiveness in some
okay.
fashion. So that would be our, and they may have been aggressive in some fashion. I mean, they used to talk about children, serial killers. One of the
Yes.
indices was, cruelty to animals. Um,
Oh, well, let me tell you,
mhm.
sorry, let me
No,
give you
no, go ahead.
this. So
Mhm.
I did a CTT session one time where I came across someone who, back in a past life, was killing animals. Now, not killing them because they needed to eat, but it was exhibiting cruelty to animals. So they would
Right,
capture like squirrels and rabbits and I mean, this is going way back hundreds and hundreds of years. And
right.
what we found in the CTT session was that the reason for killing the animals was because the person felt so disconnected that they wanted to feel something. So they had to resort to sensational, killings or sensational rituals to try to feel some sort of emotion. And it had
Hmm.
to be extreme. So, what do you think about that? Do you believe that it's because these people just numb out from the trauma and then they're trying to reconnect the emotions back to the soul, back to the subconscious and the conscious mind?
Well, as a licensed clinical psychologist, I would trace, and I think, and I believe that people that, are these kind of killers at times, And at other times, remember, like serial killers will have a family sometimes and children and be fine. But then other times, then they're out, with a project of killing somebody. Um, that there could be a variety of underlying disorders and often maybe multiple mental disorders they're having. And when I think about the particular case, if you will, that you're talking about, it could be two things come to mind that would fit with, in general. Now, of course, we're going to say they're narcissistic, right? They're not caring or empathic about the feelings, of others. And some people will kind of try to even, when they classify like people, these criminals, as like an antisocial personality disorder or a narcissistic personality disorder, which all are great descriptors, these disorders, but they don't really get to what is underlying going on. But they would be accurate to say that they were that way. But then what's going on below? So when and that's where the clinical evaluation, where you would pull out the diagnostic statistical manual with your client to ask whether or not, if they have depression, to ask them, well, could it be a bipolar depression? Like you're not going to ask that question directly. You look and ask them questions regarding have they ever had a hypomanic episode or manic episode by describing the experience, like, have you ever had a period of time for a week or so that you were on top of the world, grandiose, on the go, or you were just so irritable and kind of acting out dangerously for a week at a time? Does this occur? That's kind of a criterion for asking more questions to see if it was a bipolar depression versus a unipolar depression. And having even a single episode similar is enough to kind of say, oh, well, this person isn't having just a unipolar flat depression for which they need an SSRI only. They need multiple, tricyclic, I'm not tricyclic, a typical antidepressant that is doing more and a mood stabilizer to kind of like what goes up comes down and to get them stabilized. So a person like that, speaking of which, so I think you're getting what I'm going to say, is this person isn't numbed out per se, although they might be, I'm going to add to this, but they might be in a depression. And what happens if you have a bipolar depression, the person has developed a coping mechanism of being able to, they don't have to go to the bar to get some euphoric cocktail going. They can just spy something shiny, put their running shoes on and chase it. And then they can elicit their own euphoric cocktail, their own dopamines going up, their own serotonin, their own adrenaline. They can get a kind of out of their depression, not numbness per se. They can get out of that depressed feeling by spying something shiny and doing it. And it could be if they've been, experienced aggression in their life, and they've had the role model, the experience with it, they could just, lash out at somebody. Irritable outbursts would be one of the criteria. Like you just go into an irritable outburst for 4 days straight at people. That can be a hypomanic episode.
So do you think that there's like a switch, like a psychological switch that goes off that causes people to go on some sort of violent rampage for a period of time? I mean, what do you think about that?
Yes, that can be, like it's not always one thing, but I from what I remember now, Ted Bundy, for example, remember Ted Bundy, he was a serial killer.
Mm.
And he was big name one, and he was finally executed. And I believe, Dorothea Lewis, the psychologist or psychiatrist, I'm sorry, she did evaluate him. And for one, he had bipolar disorder. And in fact, there was an astrologer that started sending in information to the police department and said, seems like, and don't quote me on this, that every time that the moon went into Scorpio or in Mars, it would that something in Mars that he would act out. And so she predicted actually the dates that there would be some more killings, and she was actually correct. And according to the evaluator, he had bipolar disorder. And so there are different types. Type 2 might be a roller coaster of moods up and down. And so it could be like that, go into a flash rage. Or it could be episodes like, a week or weeks that they're in this manic agitation where they just, feel they have to lash out. So in that case, it's a biochemical switch in a sense. It's their biochemistry is up and down, magnet depression. And when they get in dramatic state, that's when they act out. And so that would be kind of a switch internally, biochemically. But also, they can have multiple disorders, or they could have another disorder, dissociative identity disorder. And one thing I want to just say at this time is that, I don't think there's any reason to have prejudice of whether or not you have a unipolar or flat depression withdrawn, and you're feeling very sad and suicidal and you don't do much, versus a bipolar disorder where you have learned how to pull yourself out, and even though it backfires, I just had one client, for example, and their mother, they figured out they got good help, and she by college knew she had a bipolar disorder, and but they're more functional, people with the bipolar depression versus the unipolar is more, they look depressed, the unipolar. They're just not doing much, they're withdrawn and so on. And the bipolar, in fact, when I was in school, in graduate school, many, many years ago, they thought that bipolar didn't actually begin till middle age. And that was because it didn't catch up with them in the life wreckage that had been caused, in a sense, if you will, till that age. And they actually looked depressed and got depressed with what they've been going through, because they would kind of cycle through, kind of being depressed, but coping with depression by getting manic and working so much, or being in a relationship and maybe acting out sexually or overspending. And it catches up with them. So every time they act without thinking and just despise something shiny, put running shoes on to feel better, that they come down and all their euphoric cocktail finally what comes down, and they're in kind of a low from their chemicals not being up anymore. And then they realize, oh my goodness, I just overspent and I'm in debt now or something, or I just slept with somebody and I didn't want to. I don't want to ruin my marriage,
So, but see, that raises another question as well. Like, so when somebody, let's think of it in terms of like a domestic violence situation.
Mm-hmm.
When people are in those situations and the abuser has an outburst, and then it's almost like after the outburst, then they become extremely apologetic. I'm sorry. I mean, do you feel that they're actually really apologizing? I mean, what is that cycle about?
Well, there's a variety of things. Remember, people aren't it's not a clear cut that people are narcissistic and they're just gaslighting. They usually have, in my opinion, they have underlying root functioning disorders. Like if this person went into a manic rage or irritable outburst, they might try to later on, rationalize it. Well, people have defense mechanisms, but it doesn't mean that they were really that they're lying about it, that they say they're sorry. Especially if they begin to understand that they have this and they're given the correct medications, because they're specific more for bipolar than an SSRI or something with tranquilizers. That's not the ticket for a bipolar disorder prescription. So it's the thing of it is that also I was going to bring up that kind of is related to what you're asking, is they could also have dissociative identity disorder, which is what I was talking about before, that when a child under the age of 8 goes through chronic stress and they don't feel that any parent or any caretaker is going to actually be able to get them out of the situation, they're creative enough to mentally escape, to self-hypnotize. And so instead of realizing maybe, God forbid, that they were going to get sexually abused periodically, at night, they learn to self-hypnotize, go away mentally, kind of escape, let another part of their uh, brain hold that traumatic experience. When it's over, the amnesia walls are put around it, and then the child can get up the next morning and head to school and go play with friends, and doesn't have that memory, of what's going on. It's called dissociation. And once a child has, and it could be from anything. I mean, it could be from being in the household where there's domestic violence, which is terribly scary. You're thinking, parent might be died, or you see some blood or whatever. It could be even just one of your siblings has got a brain tumor. This, I'm just thinking of people, and that one's going in and out of the hospital, and the whole family is just, and is depressed and chaotic trying to treat this. It doesn't have to even be just sexual, physical, verbal abuse. It can be, medical problems, or a parent who's got cancer is constantly in the hospital. And that would be very hard for the child, and they pass. If any of this happens chronically and it could be a neighbor, or it could be anything, or it could be
Yeah.
bullying at school. They have a bit of autism, and they're, for example, I think of different people, and they're bullied at school, and they have to go to school, right? And they're going to go in, they're going to be bullied every day. That's enough to make a little child dissociate. And just children, they're very creative and imaginative. I mean, they think their teddy bears are real, right? Or whatever, they're dolls. And so they can create that they just went away and they're not there. There's other parts over there. But the problem with that is it is a coping mechanism, but it also ultimately winds up being self-sabotaging. Because every time there's a new stress, their way of coping with stress is just to develop another part of their brain, another part to hold it. So they go to school, they get a part that's, a student part, and what happens when you go to school and the bully's out, and you got to have your if bully walks up or a friend walks up, you got to have your social part for the friend, or you got to, and then you're feeling a headache or feeling dizzy because another part that wants to be students out, and they're kind of inner fighting going on. It's not an easy way to live. And you don't know. Parent can look at the child's face and see that he's switching or he's got parts. They'll kind of know, like, hey, wait a minute. I just talked about this, and now I'm talking to this child. He didn't have any idea what I just talked about. What's going on? Well, he wasn't.
Yeah.
He wasn't up front. He was the one who took the info. And so there is what you were saying, that switching. So what happens a lot in relationships, in fact, they're called borderline personality disorders. You've heard of borderline personality disorder, most people, right? That's the description. That's the behavioral description of the disorder, what they look like from the outside. Remember, I think there was a book, bestseller little book. It was called I Hate You, Don't Leave Me.
Oh,
Because
yeah.
they have the part, they have more than one part probably, but they have the one part that totally devalues you and pushes you away. But then they got the other parts, like the clingy young child that doesn't want you to go away, and that's hanging on to you for dear life, and they're switching. In fact, in the diagnostic and statistical manual of mental health, where we have to do our criteria to give the disorders, the people with the borderline personality disorder, all it is kind of switching. For dissociation, you only have to have two or more alters or parts. So well, there you go.
What does that mean? So what does that mean? Is that where your parts of your brain has disassociated from the main running of the brain? What do you mean by that?
That was an excellent question because I didn't say what I meant. It's two or more alters or personality parts, is what I meant to say. So I'm glad you brought it up. Does that make sense?
Yeah, it does. So do you believe that violence, like flash anger, irrational violence, is a survival mechanism from, from past traumas? Or, I mean, what do you think it is? Do you think it's a desperate attempt to survive?
I think that what it is that a combination of DID where the person, their protector part, because when you get to be close to be a teen or earlier, you're going to have to stand up for yourself, right? But if you do it, if you, all the way you handle stress is to mentally go away, self-hypnotize, and let another part of your brain handle it, well, then you're going to develop a stand-up guy, right? Well, that stand-up guy is going to be selfish, competitive, manipulative, a narcissist. So all
Mm.
people with DID, they're not narcissists. They're seen as narcissists, but they have a part that's their stand-up part, their protector part. That when dad was getting domestically violent and maybe pushed you down the steps, that you developed a part that sometimes was, help you not be harmed or whatever. But that part is in there. And so when something triggers that, say when the man's grown, and I'm thinking of actual cases most of the time, the man is grown and he has DID and bipolar in this particular case, and he hears something loud in the house, his protector part is going to come out and start yelling and screaming and coming irrationally at the area, for example, of where the people are, where something happened. And it's really just to put down the enemy. The protector or terminator part in all the modes or parts of a person with DID, his job is to put down the stress for the host. And in fact, when I was working with this particular person, I can tell you that one of the things you do is that once you've evaluated, it's found out that they are able to see themselves as if they're looking at another person, or they do have big memory gaps for no reason, or they do hear internal voices, little chatter evaluating their things, and et cetera. And you score and and you find out they have DID, they had a trauma before age 8 on chronic. That part, who is a protector, terminator part, as I call it, because the goal is to smear the enemy, your wife, your spouse, your, your child,
Mm.
whatever, to put the stress down. That part just pops out when it's needed. Like in this particular case, it was a fear that when I asked that particular client to look through his eyes when the narcissist came up to the front and talking in the therapy, to look through his eyes down at his body, he looked down and he was shocked because he said this was like a 50-year-old man. And he looked at it and goes, "What am I doing? This isn't a young child. He's a grown man. He can handle himself."
Right.
So a lot of the therapies just help reintegrate the shatter that happens when a child is put through chronic trauma. And then
So,
if there has been aggression, then they have a part
mm.
that will role model and develop to be a buddy to the aggressor or to handle it. And that's in them that can be triggered, like in this case, just from a noise in the other room. It sounded like maybe somebody's going to push somebody in a wall, like would have happened to his mother when he
But would you say that that's almost like PTSD, like a war veteran who, when they hear a firework, they react or they overreact because of it triggers? So if they hear a loud noise, so if a parent hears a loud noise in another room and that brings about flash rage, flash anger, wouldn't that be the same as like a PTSD response from a soldier?
exactly. It is
Oh.
worse because it's complicated. You see, when a person as an adult and develops it is called PTSD. It's called complex PTSD or childhood complicated PTSD. That's what dissociative identity disorder is. And
Mm.
it's just more complicated because when an adult has one mind and they know I was in this war, and it's still hard. I mean, they still have to manage PTSD symptoms, but they get a flashback. And then all of a sudden they may think they're in that, or they're in a tight setting where they think something could happen. They're vigilant and they're getting a panic attack or whatever. That is regular PTSD, just that from witnessing or experiencing a life-threatening event when you're older.
Mm.
But when you're a child, you don't just get PTSD. You actually get a dissociative disorder. You actually dissociate and start, being able to manage it even better, right? You can kind of mentally go away and it doesn't happen. You put amnesia walls, you don't even know. But now you've got all these different people parts alters inside, if you will, by the time you're an adult. and or even it just progresses every time there's a new stress. You're going to just learn, you use your go-to emotional defense by dissociate. Okay, I'm go
Hmm.
away. I'm so I'm not here, and that part of me handle it. So you wind up a lot
Yeah.
of chatter, and that you do get the triggers just like you said, but they're kind of up to bat. It's kind of they're all on the bench watching, and then all of a sudden noise is up in the house, and then it's like, oh, Terminator's up to bat. I got to go put down the enemy, go get that aggression under control. So it's kind of like switching. It's called switching, kind of like the borderline personality switches from, oh, I love you, you can't leave me, to, I hate you, that, into a different mode depending on what's getting triggered. But it is very
Mm.
similar. It's just more complicated, and and so when and so when you think about things, I think about someone like, for example, Dahmer, Jeffrey Dahmer. Do you
Oh
know
God.
that one serial killer?
Yeah.
I mean, this would be, I don't want this to sound negative to the parents, because it didn't seem to me that they were negative. They had marital things and so on. And I'm sure there was stress there, but even taking Jeffrey out to work on chemicals, the father, I think, was a chemist, and it wasn't his fault at all. As far as his son, can't blame a parent for what a child does later in their life, because nobody knows about DID and bipolar, and that's the whole point of what I'm talking about, is that people need to really assess children and not do to children what could harm them, but then also help them if they accidentally got harmed in the things, and treat them so they don't grow up to be a serial killer, right? Or a school shooter or whatever. So, like in this
Mm.
case, what just comes to my mind is that I think his father would take him out and they would do chemical things with animals, right? They would, like, because he was a chemist, and they could boil the bones and stuff like that. But what did he end up doing when he had a part that was a buddy to dad? If you dissociate, then whatever comes your way, is you're going to develop a part or alter to be that. So if you have a dad who's a chemist and he wants to go in, he's got this shop, and you're working on chemical things and stuff like that, well, you're going to develop, that's a little stressful for a little one, right? A little 8-year-old, 6-year-old, he's already dissociated for whatever reasons, and he develops a part that does that. So when he's out and he has that opportunity, what's he doing? He's putting people in acid, and doing the bones. Things
Yeah.
develop. We don't, you wouldn't know. Does that make sense?
Yeah.
And that
Yeah. Yeah.
was
That's extreme, you know.
that's major extreme. But the thing of it is, when they've got the DID, it can be extreme. We're talking extreme. We're talking about what could cause aggression. Well, they have a part that got along, was stressed out because something aggressive was going on, and they developed a buddy for that part, a buddy part. And the people parts alters are like horses in the horse race. They're all running down the track with blinders on, right? And they just have their own thing, and there's no real present. They're just there to win the race. And that's kind of like when people with DID switch, that part is out doing its job. It's been called, they heard a noise, the protector's out, it's going to go cream the enemy. That's its job.
Wow.
And it's running
Yeah.
around the racetrack, blinders on, doing what it's supposed to do. And until you get therapy, you can't coordinate it. You can't go within and say, "Hey, wait a minute, don't come out now with my spouse, and if there's a noise in the house, we're all
Mm.
okay here." You have to have those powwows to talk within and get everybody on board to understand. People, every decision they make, they got to have a powwow within internal family systems. Is the therapy.
So I have a question.
Mm-hmm.
So, okay. And thank you for that explanation.
I hope it helps.
My question is, so you're reintegrating the parts that have been fragmented. The psyche has been fragmented through trauma, through bizarre experiences or whatever.
Upsetting
And
experiences, yeah.
so what, okay, and before, we did a bit of cheating. So before we hit the record button, you were telling me that exercise, certain types of exercise or exercise tends to relieve trauma. Why is that? Why does exercise do that? What is it about? Because then I asked you the question. In CTT, we do bilateral tapping, which seems to be more effective than the EFT, which is just, one thing at a time on different but the bilateral movement seems to be key in resolving trauma. What I don't know if you can answer that, and if you can, it's okay, because maybe that's something we need to pursue. But why, in your best, through all the years of experience that you've had, why do you think that is?
Well, when you mention exercise, there's a lot of research to show that it is very beneficial. In fact, I just saw this one by, I think it's Dr. Sam Waterling, Healthcare, and it was had a catchy little title where it said, "Dance 10 minutes a day and reduce your risk of Alzheimer's or dementia by 72% or 76% or something like that." So it caught my eye to look at that, right? And dance itself, a particularly kind of slow movement dance or jazz or Latin, things like this, were have so many benefits. But all sports, all exercise has these benefits of, if you do it 3 times a week at least, like 45 minutes, you increase your serotonin, your positive mood neurotransmitter. You also increase your endorphins, your better endorphins, your own natural painkillers. You also release lactic acid. It reduces the lactic acid in your muscles, so that reduces your tension, in your body and your stress. So those in themselves, those are just good across all sports. But he was saying dance even was better, partly for the prefrontal for a variety of things. Less stress on your legs than just running or something on asphalt or whatever. But also it was to get the brain, neural pathways, because you're doing something different. You're bilateral. It's kind of like how I'm relating to that with the idea of the bilateral. Things are getting into your brain. New neural pathways are going into your brain. You're running down them. It's not just straightforward. There's patterns you're picking up. There's changes you're picking up. And I can't answer about exactly why bilateral, but I'm going to investigate that. And maybe next time we can talk some more about it. But my guess is partly that it does affect more areas of your brain that way. And if, say you have a dissociative, that, is connecting to more parts of yourself in a sense.
Yeah.
Mm-hmm.
So it's almost like the exercise is trying to reintegrate um, different parts. But I still don't think it gets to the root. And the reason I say that is
Mm-hmm.
because I find, Dr. Creekmore,
Mm-hmm.
I find that energy the energetic makeup of the individual, their energy field, their biofield,
Mm-hmm.
we're just like satellites. We send and receive transmissions all day, every day. There's lots of things that can alter the energy field, like the chemicals that are going around in the brain. I believe you said,
Right.
if there's a thyroid issue and the hormonal issue, that could bring down the mood. But I
Sure.
do find that it's an energy issue overall, and that
Uh-huh.
you have to get to the root cause, which is why is that energy there? Why has that dark energy invaded my space? Why has that trauma energy, that negative energy invaded my space? It's taken away my positive of aspect of self, and it's replaced it with a negative aspect of self. So I think that what spirit are saying is we can only go so far with exercise, but it is a good practice to do.
Right.
So what would you suggest for the audience that, recognize that they have trauma. Everybody's got trauma, right?
Right,
Everybody has some form of trauma. What
right.
would you suggest would be some things that they could do to kind of reintegrate these fragments? I mean, what do you suggest?
Well, one thing that comes to my mind right now is internal family systems type
Mhm.
therapy. I mean, we do know we want to have cognitive behavioral therapy, which is change your thoughts, change your feelings, and then change your perspective and behavior. And that's the most effective form of therapy, or branches of it are. But this other a form of therapy called internal family systems, which you probably get, has to do with your inner people parts inside. That is and it can be for anyone, supposedly people that don't have any DID, whether or not it's a mild DID where you just kind of switch into mood, not a complete blackout between alter, because like 20-25% of people who have a DID and switch into different personality parts or modes or moods are not at the alter, blackout between alters. Like, oh, there was a good movie, I think it's either 21 or 26 or something, Minds of Billy Mulligan. It's a true documentary. I know that you were saying that people are interested in true crime documentaries.
Oh, yeah.
That one, I think it was on Netflix. Billy Mulligan, the 21 Minds of Billy Mulligan, something like that, was true story. And it would be interesting to watch that, and you could get a feel. They didn't find out what he had until, he was much older, and that's normal. I would say less than 10% of people actually get diagnosed before their way into adulthood with it. But internal family systems, speaking of the, if you will, the integration, is where you, well, if say I was doing a therapy session and say with somebody that I thought might have it, or maybe they don't have it, but I would usually know whether they have, because I've done all the preliminary evaluation first two sessions, and I know. But they come in the office and then they talk about something they were really upset about. And so, what you do with internal family therapy, especially if you think it systems therapy, is if you think it is a part of them in another part of their brain, not the life managers coming in and able to handle the appointment, discuss, and so on, but it's just something that they put in unintegrated, like you're saying, a different
Mm.
part of self, different part of their brain, that you ask them to get into the feeling, experience the feeling, so that that part is brought to the front. Then you ask that part of them, they ask that part to sit next to them. Like, remember inner child work? You used to have the transactional as a parent, child, adult, or, do the inner child healing work is kind of was around a lot. But you're asked, but you have many inner children, they may not all be young in this case, but you ask that part to sit next to you inside, so you can have an inner child talk. You adult can talk to whoever that part is that's upset, who's been triggered to come out. And yeah,
Okay. So I read about, okay, tell me if this is what you're talking about. I read
okay,
about a solution where the adult part of you is on stage. You imagine that the adult part of you is on stage,
uh huh,
and you have the spotlight on you. You're
uh
the
huh,
only thing that you can see. The audience is like in the dark. You can't see the audience.
uh huh,
And then you ask a question. So, say we're talking about violence. So, if you ask the question of something to the point of, why did you, bully me, or why did you insult me, or something like that. And what you're looking for is your child self to answer the question. So you're putting the question out to the audience, and
mm-hmm,
yet you are, you're looking for that part of your childhood to answer. And then he said, and I can't remember who the guy who came up with this method, and I'm sure it's not just him. I'm sure this has been done before. And then he said that if you practice this, that child will appear. So that spotlight will move off of yourself, and it will move to the child version of you that can answer that part of the question in the audience. And that's all you'll see. You'll see the spotlight move on that child, which is that version of you. And then they start answering the question about how did you feel? Why do you think that happened? Or, so I remember seeing that in a book somewhere and or hearing about it on a podcast. I can't remember exactly. It was a long time ago. And I actually tried that and it did work. It did
Interesting.
work. Because a lot of people they want to have therapy, right?
Right.
A good therapist like yourself is it's difficult to find, and a lot of people they want short-term fixes. We're getting our attention spans are getting smaller. They're wanting to they don't want to go through the intake and going through the process of therapy. A lot of times they're looking for quick fixes, and maybe they they don't have the money right now. I mean, we are in a bad economy, so but the obviously that is something that they could practice. It's like, so you say like visualize the child sitting next to you and you're just like having a conversation.
Yes, yes. And then you start with what it is that was bothering you when you felt out of sorts during the week. And then you try to get into that mood or mode of what were you thinking? What were you feeling? What memories were coming up? Those are the triggers in a sense. What was going on? Where did you feel in your body? And then when you connect to that part of you, ask that part of you to, with your eyes closed, you're just sitting there and doing inner child work, and ask that part to sit next to you so you can just have a conversation inside yourself, and reach
Mm,
out and say, hey, when did you come to me? What was the trauma or the memory? What's your first memory? Not what you've heard, but what's your first memory? And what were you feeling? What'd you come to help me with, kind of thing. And but I guess to back up, I would say that, and that is something you can do, inner child work. And actually, this was something that came up, I guess, at one of the you know classes at church, progressive church, like a unity religious science that we were in, where the minister had us work on a to say when you get angry with somebody, for example, or somebody that really bothers you, irritates you, that what you do is you describe kind of what's irritating to yourself, and then you say, well, in what way am I like that, right? Because it's probably irritating you because it's triggering your own feelings about that in your
mm,
own self that you don't particularly like. And you can actually do inner child work to heal that. Like, in other words, you'd say, okay, I want a part of me that's like that to sit next to me, and on the couch. And when I've done inner child work, you can even ask them to move back and forth, like sit here as the adult, then okay, sit next, move over a little child, let the child talk. Now go back and forth, inner child work. And you can do that to do heal, maybe even things like not liking somebody else and kind of finding out where in yourself you didn't like that. And then if something came up, and you can heal that part of you. But the easiest way, I think, would be partly to go to a therapist who does internal family systems therapy. We all have different specialties, or and I'm eclectic, so we got a bunch of them. If you can find somebody that does internal family systems work, they will do it right there with you, which is always good to have support.
oh wow,
And
okay.
I don't know how, I mean, insurance these days is pretty good still. I mean, you might still
Yeah,
be
it
able to get
is.
little copay, or you can actually do an EAP, which is Employee Assistance Program. A lot of companies will provide like 5 sessions or something, like, or 10, or I've seen 12 sessions where that's free. It's just part of your
Yeah.
benefits as an employee. And then if you could just specifically see if you could find somebody that does the internal family, the inner child work, the internal family systems
Mm.
therapy, then they would work with you just like that. And that is very healing, because it's hard. You want to have this positive consciousness and this, and then, but if you're in different kind of parts, one, you got to pass that positive conscious on to the different, find out who your parts people are, pass it on to them and get them on board, But if you heal them and they're all up at the present with you, then you're able to do that better. Does that make sense? What I'm saying?
Yes, it does. So, I mean, look, I'm going to post your contact details. It'll be highlighted in the comments
Oh,
below.
okay. Sure. Sure.
And also we'll post your links to your website so people can
Perfect.
see
Thank you.
your books that you've written. And I just think you're amazing. You have so much knowledge.
Oh, thank
And
you.
I know you could talk about this all day.
Yeah.
No,
Yes.
and
I
really,
really
it's
did.
such a fascinating subject, especially like as we're going through the CTT and we're working and trying to make our lives better. And you've got to
Absolutely.
clear out all this stuff, and then you get down to the soul level. I mean,
Right.
it really is absolutely fascinating. So if anybody does want to reach out to Dr. Ann, please feel free to do so. And I will put your contact details listed down below. I mean, we only scratched the surface today. So
Sure.
no doubt we'll have you back again and again and again to
Yeah.
talk about more. Because you know so much. You
Oh, well,
really do.
well, thank you. You too. So
Oh, well,
we're good. We're
well,
good
I
team.
just get through it one CTT session at a time. You know what I mean? Like I'm sort of a learn as you go. But
Right.
you obviously have all the credentials and I mean, you
Oh,
know
much.
about all these disorders and the fragmentations of the psyche and
Yeah.
it's really amazing. And people I know that they love the true crime and the psychology behind the crime. So we will definitely touch on that more.
Perfect.
Um, I think it fascinates people.
Yeah.
Like, how does somebody who is born, who's like, 100% pure and positive and innocent, turn into some sort of killing machine?
Exactly.
How does that happen? And the psychology behind that is really what fascinates so many people.
Right. And how can we prevent it and help, so it's not happening? It's so important too. Yeah.
It really is. I think people miss the signs, or, when you said to get the child therapy, I was thinking, yeah, but that's in a normal household, right?
Exactly. So
If
who's
they're
going
growing up in a chaotic household where the parents are they're deranged, they've got major psychological issues themselves,
exactly.
that's not even an option. It's up to the
Right.
teachers and the caregivers, outside caregivers, friends, to notice it. And oftentimes people just do not want to get involved.
Well, I think part of it is for us to do help with this paradigm shift for on a variety of levels, that we've talked about today. But on this particular level, would be for us to get for everyone involved now hearing to understand that these disorders, there's no stigma to them. It's stuff you've either gotten inherited something to work on with the bipolar, the person's had trauma and they are a child and they've got to do some healing, with the complex PTSD. That
Yeah,
if we all can understand this is occurring normally, if there's
right.
abnormalities are occurring normally, and we get on board to just go, okay, let's deal with that and help people with that. And then the people that can't do it in the family situations because they've got too many disorders themselves, for example, that they need help with, that we would all be kind of wiser to know who we're dealing with, because like you
Mm,
mentioned earlier, sometimes say someone did come a part of someone, or they were in a manic rage, irritable rage, or they had their protective part came out and did something with their spouse. Well, guess what? The rest of them is left completely devastated in a sense by the behavior they did. You know what I mean? I mean, they got to
mm,
take responsibility. There's only one body there, right, with them. And
right,
they actually,
right.
if they kill somebody, then they got to go get do the time for the crime. But it's not like, so if you see the minds of Billy Milligan, it will really show you, because they're kind of stuck themselves too. You know what I mean? I don't want to be spoiled and tell you about it, but as I say, one part of his would come out and got him into where he did, and others just he's the most gentle, nice person, and but he's stuck where he's stuck, given that he had a part that was antisocial personality disorder, if you will.
Yeah.
Making fun of that in a
Yeah.
sense, it's more than that, but it was that. So we
Well,
all
this,
get enlightened about this, and then we can get our inner healing, under control. Then we can be at our highest self and create, manifest, and help everyone else
yeah.
get on board with that too. So that,
No, I agree. So I really appreciate you making your time available for us today.
oh, I
Thank you
love that.
so
Thank you.
much. And again, I will post all of those links in the comments listed down below. And thank you so much, Dr.
Well,
N. We
thank you so
so
much, Liz.
appreciate you.
You're amazing. I
I
appreciate that.
haven't got a patch on you, Dr. N. So thank you.